Hello, Dr. Firnhaber here at Lincoln Disc and Nutrition here in Lincoln, Nebraska. Today we have another edition of 10 Minutes of Truth. So today I want to talk about an article out of the Journal of Joint, Bone, and Spine, May 2021. The name of this article is called Vagus Nerve Stimulation in Musculoskeletal Diseases. This is a very, very important article because it talks about how we can improve body function without doing invasive procedures. So the vagus nerve controls all visceral functions, which is heart and lung, and then all our visceral organs, abdominal organs. But it also controls anti-inflammatory and pain functions. So the vagus nerve stimulation was initially developed to treat refractory epilepsy. And that means epilepsy that just couldn't be controlled with pharmaceuticals. It's currently being evaluated for musculoskeletal diseases, several musculoskeletal diseases, such as rheumatoid arthritis, where it dampers inflammation, and it may limit fatigue in Sjogren's and lupus. It decreases pain in fibromyalgia and erosive hand osteoarthritis. So the vagus nerve basically connects the brain to all our visceral organs. So it's the connective nerve between the brain and the parts of our body that we don't really think about, like heartbeat, breathing, digestion, immune system, okay? Things that we just take for granted. And a lot of times the vagus nerve will get turned down or get dysfunctional due to emotional stress, toxicity, long-term illness, things like that. And so when we turn the vagus nerve back on, that can actually upregulate and improve human function. And so the way that we stimulate the vagus nerve, and that was in this article, is in the left ear, in the ear. This part, the Simba concha of the left ear, which is right here. And we have a vagus nerve stimulator here in our office that works really, really well. Now, if you look at what does a vagus nerve do? What else does it do? Well, it has tremendous influence on inflammation and autoimmune and pain syndromes. For example, it counteracts inflammation and arthritis. It reduces symptoms in fibromyalgia patients. It can relieve migraine pain and be beneficial for inflammatory bowel disease. But I have also found vagus nerve stimulation very good for depression and anxiety and many, many GI dysfunctions. And so I use it for a lot of these, and it works very well. I think many, many people in our culture that are sick, in fact, I would say most chronically ill people are walking around with vagus nerve dysfunction. The vagus nerve isn't working, and a lot of times that's why they're chronically ill. So a lot of things that people are being given pharmaceuticals for is actually vagus nerve dysfunction, and it's a fairly simple thing to upregulate the vagus nerve. And that may need to be done multiple times to get it working properly. But it can be done. We do it in our office on a regular basis. These people don't need pharmaceuticals. And a lot of times, when you stimulate the vagus nerve, they don't even need supplements. They just need the vagus nerve stimulated. So this article here, back in May of 2021, basically buttresses and undergirds things that we've been doing in our office now for over a year. And I just want you to know that this is a very powerful therapy. It's non-invasive, and it can be very effective. And now there's really good science behind it. So That's all I have for today. If you know of somebody, and most of you do, most of you know of somebody that may need vagal nerve stimulation, you know, people with fibromyalgia, people with GI issues, they would be a good candidate for this. So you can let them know that we do that here at Lincoln Disc and Nutrition here in Lincoln, Nebraska. And I hope that you got something out of this 10 minutes of truth today. And hopefully this is something that can help you and your friends. Next week, or excuse me, the week after next, we're going to do another 10 minutes of truth. I've got some other really great information to give to you, and we'll see you then in 2 weeks.